The East Central and Southern Africa Health Community, together with its constituent College of Health Sciences, specifically the Professional College of Surgeons of East Central and Southern Africa, the East Central and Southern Africa College of Nursing, and the College of Anesthesiologists of East Central and Southern Africa, in partnership with the Ministry of Health of the Kingdom of Lesotho, organized the first ever high-level specialized regional surgical camp under the theme Bridging Knowledge and Skills Gap and Promoting South-to-South Cooperation. The camp was organized by ECSA ECSA Health Community Secretariat as a follow-up to requests by the ECSA Conference of Health Ministers of Mombasa in 2011, with the aim of enhancing capacity and actions to improve the health workforce situation in the region. The camp attracted senior medical experts, professors, senior consultants, and nurses from East, Central, and Southern Africa Health Community countries. The Honorable Minister of Health of the Kingdom of Lesotho, Dr. Pinkima Namolela, opened the surgical camp on the 29th of November at Queen Mamohato Memorial Hospital. The notion behind the organization of this medical surgical camp and many others yet to be organized in the various countries in the region is a representation of the innovative service delivery modality, especially of specialized care to patients in need, especially those residing in distant locations and in most cases those that cannot afford to pay for such specialized service.
The presence of this camp means a number of things. First of all, doctors are learning, younger doctors are learning from their skills, and then experience is being shared, and then capacity building. The presence of the camp has saved us a lot of money, about 61 operations, highly specialized operations by skilled, specialized doctors have been performed. And this has saved Lesotho 832,000.
The East, Central and Southern Africa Health Community as a regional organization was established in 1974 and consists of 10 active member states, namely Kenya, Lesotho, Malawi, Mauritius, Seychelles, Swaziland, United Republic of Tanzania, Uganda, Zambia, and Zimbabwe. The organization was established to foster and strengthen regional cooperation and capacity to address the common health needs of the member states, a cooperation that was indeed manifested in the organization and running of this surgical camp. One of the health challenges that is of the priority in the region remains the inadequacy of human resources for health in terms of numbers, skills, competencies, among others.
Even though we have a crisis in our region, we also have capacities, like all these specialists whom we have brought together from many countries, from Uganda, Kenya, Zimbabwe, Zambia, and so forth. So we do have something in the region which we can share. And this is now the auspices of this particular camp, bringing these people together to help the Kingdom of Lesotho.
Africa as a region carries 24% of global disease burden, but has only 3% of the world's health workers and less than 1% of the world's financial resources for health.
At regional level, our strength lies in the fact that when you combine our countries within ECSA health community, you have a complete spread of specialties. But none of these are fully represented in each individual country. So what we wanted to create was an opportunity for the countries within ECSA to combine together, go into one country and provide a camp where we make surgical services accessible to and available to the population that may not be able to have it because of the crisis in some countries or shortages in the other countries of the specialties concerned.
It is widely acknowledged that a minimum density of 2.3 professional health workforce is required for effective health service delivery per 1,000 population.
Unfortunately, this region does not hold very many of these noble professionals. At the moment, Kenya seems to be leading the way with more than 150. A country like Tanzania, where I come from, they are less than 20 and a population of 48 million. Uganda are trying their best. They are coming to 30, but that is not enough if we are to do the per capita distribution.
This camp is comprised of surgeons, anesthetists, obstetricians and gynecologists, urologists, specialized theater and intensive care unit nurses and other medical personnel who came together as a team from the region, not only to care for and treat the people of Lesotho, but also to build capacity of the health workforce at Queen Mamahato Memorial Hospital to deliver such services.
These doctors, many of them, we are calling them doctors, but they are professors, they are senior nurses and so forth in their respective countries. But they have given their services free of charge without a single cent for their work which they have done this week.
Specific attention was given to those individuals in need who, in one way or the other, could not access such specialized service because of lack of expertise and capacity in the country. Throughout the 10 days duration of the camp, capacity of personnel in the given specialties was built through continuous on-job training and demonstration. The medical surgical camp did not only benefit the personnel and patients, but another added benefit was of reducing costs incurred by both the patients and government, together with the costs associated with transfer or travel to referral hospitals in the region. To the individual patients living in a rural village who would never have dreamt of accessing such a service, this was a life-saving opportunity for them.
We believe that one of the things that will sustain this program is that spirit of volunteerism that exists among health professionals and the desire to make our services accessible by the populations which deserve them very highly, because a poor person with a disease is very different from a rich person who can pay for care anywhere else in the world. And we feel that we have an obligation to provide services to these people, and I believe that that spirit is going to carry people through a lot of things.
This medical surgical camp has brought back hope of some patients whose health has been in a balance. The high level and specialized surgery that has been given in this camp especially is considered to be the most technically demanding of all the skills that a physician has to master.
Bothata ba ka ba ho tla mona ke ne ke na le mosese o itaolang ke la ka ya le Bloemfontein empa Bloemfontein la faila empa mona bontate ba entse ka motsotso o fokolang hobane ke qadile ho sebetswa ka la bone empa neng ka tshekole nana ka Mantae ke ntshitse ntho tsohle se ke se sa ka bonna ke nna ke ikutlwa ke thabile haholo.
Yeah, this patient, she's 45 years old. First, she had a VVF, which is she was leaking urine through the hole she sustained after obstructed labor. The urine was coming through the urethra normally. When she coughed, when she stained, so the urine was just coming. So what we did here, it was to repair, to reinforce the urethra and to elevate so that to maintain the continence. And I would like to say that this has been very successful because today we've just removed the catheter and now she is okay.
Bomme bohle ba Lesotho le lefatshe lohle dinaheng tsohle bomme ba nang le bothata bona ba mosese o itaolang dingaka di teng tse modimo re tliseditseng tsona tse seng di fodisa bothata bonana ka nnete ke re le eme ka maoto ka hona ke thabile haholo.
Unfortunately, many rural physicians have difficulty mastering basic surgical skills, and consequently, referral to regional hospitals has been the traditional way of trying to provide surgical services to the rural population.
I'm here as a laparoscopic surgeon, come endoscopist, come GI surgeon, and we did what I believe is the first laparoscopic cholecystectomy in this hospital. This should not be considered as a one-off camp. It should be, my personal feeling, these are my personal feelings, it should be a continuing exercise with surgeons in their different speciality.
So far we have operated on average 5 patients per day, and they included what we call endoscopic surgeries, therapies involving adults, and also open surgeries for undescended testes for children. And we have worked quite well as a team with the local home doctors.
This is one of the best hospitals I visited in the region, to tell you the truth. And I want to be continuing like that, but we need to have a local doctors be trained in a structured program and giving encouragement and incentives to continue in this country.
We provide high quality surgical care to the patients, and thereby we reduce the inconvenience and costs the patients would have to travel abroad. We also have reduced the costs of treating these patients to government of the Kingdom of Lesotho. At the same time, we have been able to enjoy the fellowship of the people of Lesotho. When we also come together, there is a fellowship that comes up, a collegiality.
The surgical camp was mainly trying to fill in the gaps by offering free specialized medical and surgical services, thereby contributing to the alleviation of the existing disease burden in the Kingdom of Lesotho, providing continuous medical education to healthcare workers, teaching surgical and clinical management skills to healthcare workers possessing no specialized surgical training, but who may be required to provide surgical services at any one time, among others.
You know, Lesotho is one of the 7 countries in our ECSA region that have been classified as in crisis for human resources for health. This means they have less than the recommended ratio for health worker per patient.
The ECSA health community believes that the region has come of age, and this is the beginning of the history of medical service in the ECSA health community region and will continue.
We did first time laparoscopic cholecystectomy yesterday in these hospitals, and we did a couple of upper GI endoscopy first time for the hospital, and also colonoscopy. And we did also TURP for the urologist, and something I have to mention here, for the hip replacement, we are doing total hip replacement and knee replacement for the first time in this country.
The operation has gone well, and I'm happy about it. The service to me has been very good. I know I'm not comparing it with any other, but I'm happy about it.
Lengwele lena le ne le ke ka haholo le bile le bohloko, empa ha jwale ka morao ho sebetso ha ke so utlwile le bohloko.
The ECSA health community is grateful to countries and partners that pledge to continue supporting this initiative. Special thanks goes to specialists, university professors, senior consultants and senior nurses from the region who made the camp a success and demonstrated to the region that this is possible.
On behalf of Lesotho, our patients and our clinicians, I want to say to ECSA, thank you for taking the time out of your clinic, your busy schedules, for selflessly sharing your skill and your experience, for the manner in which you assisted us, for your spirit, but also especially for your humility, for making a difference to our patients, and for imparting your knowledge to our colleagues.
ECSA community will remain grateful to all partners: Queen Mamohato Memorial Hospital, Ministry of Health Lesotho, the airline, and the production team, Breakthrough Media, as well as all others who agreed to come together in one way or the other to ensure that these teams come to the Kingdom of Lesotho to save mankind.
It is good that we do everything we can to ensure Lesotho receive the quality health care they so deserve. I wish all the specialists and experts a safe trip back to your countries, and I hope that you leave our mountain kingdom with fond memories of your time here. I will now declare the ECSA HC Medical Surgical Team officially closed.